Hi everybody, my name is Lilian Mumina. I'm a clinical nutritionist and welcome to my YouTube channel. Today I want us to discuss all matters gestational diabetes. We are going to discuss what is gestational diabetes, what is causing gestational diabetes in women, what are the risk factors, and what are some of the complications that are associated with this condition. And also at the end of it all, we're going to discuss how to manage it using nutrition and physical exercise. Simple. If you're new to my channel, welcome. I am welcoming you to this space where we're going to learn on matters nutrition and health, how to prevent diseases, how to manage diseases, and how to prevent complications and improve life. What is gestational diabetes? Gestational diabetes is basically having a raised blood sugar when you're pregnant. What are some of the things that will predispose a woman to getting gestational diabetes? You are at risk of gestational diabetes if before pregnancy, before conception, you were obese or overweight. Studies have revealed that there's a relationship between being overweight or obese before pregnancy and getting gestational diabetes during pregnancy. So when you're pregnant, there are so many changes that happen to your body. Your metabolic system is not left out. So there are changes how your body metabolizes carbohydrates, and sugar also changes a good number. But this is not something to worry about. The worry comes in when your blood sugar is higher than the expected levels in pregnancy. Remember that it is not something that is going to be so off for you to have some elevated blood sugar here and there when you're pregnant. And if you have gestational diabetes, it is important to understand that you need to take the necessary measures and precautions so that you make sure that your pregnancy is carried to term and you have a healthy outcome of it. And then if you have a history of diabetes from your immediate family, genetic predisposition. So if you have people with diabetes in your close relatives, like your mom, maybe your dad, then you are at risk of having diabetes when you're pregnant. And also when maybe you have hypertension, or maybe you've had in your previous pregnancies you had gestational diabetes, then in the next pregnancies you might be getting the same condition. If your maternal age is above 35, if you get pregnant after 35, you're also at a higher risk of getting gestational diabetes. So again, maternal age is also important in several factors. It's not gestational diabetes alone. We've talked about also fertility and any other complications. A pregnancy is termed risk if a woman conceives after 35. This is a fact that most women, me included, we don't want to come to terms with. I've relayed the information. You're the one who will decide what to do about it. How do you know that you have gestational diabetes? This can only be done through the glucose test, but in Kenya, to be specific, the diabetes or the glucose test is not done as frequent as it should be. But we would want to blame the medical practitioners. But again, when you pose the question to the women, like how fast and how frequent do you go for your ANCs, it is very sad that most women think it's a waste of time to go for ANC early, and most women think it's kujipendekeza or kujipenda when someone decides to go for ANC clinically. Please go for those clinics immediately you discover you're pregnant, because you're able to give data, or it's the doctor or the practitioner or your gyna is able to get data from you that they will use that data all through the pregnancy. This data can help in terms of preventing, and they can also prompt for tests on certain conditions. And you see, early detection, early management, reduce complications. That is what we want. So make sure that you go and attend the ANCs as soon as you discover that you're pregnant, so that also your pregnancy weight gain chart can be well documented, and they can also be monitored and all that. So if there's something that is going maybe off, then something can be identified fast. Again, if you gain too much during pregnancy, you're also at risk of getting gestational diabetes. Gestational diabetes is basically screened at maybe the 20th to 24th week. So if you have concerns about gestational diabetes and you're pregnant, or if you have siblings who have who have had gestational diabetes, or if you're in your family people give birth to babies who are extremely big, maybe like babies who are above 4 kgs, if in your family there is the complication, the preeclampsia, the low birth weight and all that, it will be a good thing for you to prompt. If your doctor maybe fails to do that, you can prompt them and ask them for that test. It comes back to the documentation, whereby your data is captured early enough during your first clinic, so that you ask certain questions. Please go for those clinics as early as you discover that you're pregnant, so that you can have your weight chart also observed and all that. So if there's any risk factor that can be identified, it is done so in good timing. So what are some of the complications that come with you as a mom having gestational diabetes. One, you risk preterm, you're risking having hypertension and preeclampsia during pregnancy. You're also risking having C-section. Those are some of the risk factors. And then for the baby, you risk having a macrosomic baby, a very big baby. And then you can also have tears. The baby can have complications like metabolic disorders in life, regardless of whether the weight was big or not. Babies born to women who have had gestational diabetes are at a more risk than babies born to women without, of getting metabolic complications such as type 2 diabetes, liver failure, metabolic disorders such as maybe cancers and all that. You would want to avoid this condition as much as possible. It was not so common in Kenya, but with the changing trends in food and our changing dietary habits, patterns, and our food production and processing systems, it is becoming more common than we would want it to be. So we want to make sure that we arrest this condition in good timing, manage it, and prevent. So what can you do when you discover that you have gestational diabetes? It's not the end of the world. The baby is going to be okay. You're going to be okay too. So what you need to do is alter your dietary habits. You have to alter your diet and incorporate physical exercise. I know there are these memes that go around on social media saying that mimba siyo ugonjwa, and it is actually not a disease. It's a stage in your life. Embrace it and don't use it as an excuse to not move. Don't use it as an excuse to not do anything. Be active. If you can do walks, please walk. Exercise has tremendous benefits when you're pregnant. One, it improves insulin sensitivity. It also makes you active. It makes your brain active. You're a bit more alert. When insulin sensitivity is increased, there's better control of blood sugar. So it reduces excess weight gain in pregnancy and promotes the right weight gain, because we're still going to gain the weight because we want the fetus to develop. The weight gain is still expected. Exercise ensures that the weight gain is not too much. It promotes vaginal birth and reduces chances of C-section in pregnancy. So how do you manage gestational diabetes? Today you've gone to the hospital, you've been told that you have gestational diabetes. So what are some of the steps that you're going to take to arrest this condition before it becomes a complicated one? First things first, you need to alter your diet. Your dietary habits need to change. And so what are you going to change? You need to reduce your carbohydrate intake. Carbohydrate is basically the macronutrient that triggers insulin production. In pregnancy, as I've said, when you're pregnant, you become a bit insulin resistant. So when you're insulin resistant and then you continue with uptake of carbohydrate, of course, there will be elevated blood glucose. As I've said, it's also normal to have a higher blood glucose than a person who's not pregnant, but it's not supposed to go beyond a certain levels. That is what we are going to prevent with reducing the extra carbohydrate we're taking. In the normal planning that we have been advocating, usually advocate for a carbohydrate percentage of 55 to around 65% of the normal dietary intake. Your meals have to be diverse. So when you discover that you have gestational diabetes, I would want you to reduce the carb intake to around maybe 40 to 45. It's not a drastic change. Of course, there will be a vacuum that will be created. So we are 40 to 45% of your total kilocalories. Your total kilocalories during pregnancy cannot be a blanket. It is dependent on age, it is dependent on your weight, it is dependent on your height, so it is specific for you. So what is carbohydrate? Carbohydrate, the energy given foods. The body prioritizes energy from carbohydrates because it is easier, and every cell of your body, every inch of your system can utilize glucose. When you're pregnant, you still need some carbs, so make sure that you do at least 40 to 45. This is 40 to 45% of your total kilocalories of carbohydrates. In Kenya, we have tubers, we have grains, we have cereals, we have vegetables, we have all those. So you would want to make a selection of your carbohydrates from whole grain cereals and tubers and the veggies. So you will want to avoid the processed carbohydrates, because you see the processed and refined carbohydrates, their nutrient density has been compromised, their nutrient quantities have been reduced, and you see the quality of the nutrients they have is also compromised. So you want to prioritize whole grains because they are whole to start with. They have a good amount of fiber. They have the other nutrients which is in good amounts. Of course, they have the caloric control aspect. So in Kenya we have foods like maybe ngwashe, we have ndoma, we have mihogos, we have oats, you can do brown breads or oat breads, you can do brown rice, you can do the brown ugali, the yakusiaga hiyo. So the one that people don't like so much, it's a whole meal. If provided the maize has been well dried to avoid aflatoxins and all that, the unga is very, very good. So you would want to take that, and then you can do the vegetables. We have the cabbages, we have the skuma, we have the managus, we have the tereres, we have the saga, we have the gourgets, we have the cucumbers, the cauliflower. All these, we have a variety of vegetables in Kenya, so make sure that you utilize them. So we've talked about carbohydrates taken to 40 to 45%. We've said we want it to from whole grains, vegetables, tubers, and then our fats. Now we are planning our meals. Our fat should be at least also 40%, because you see the normal planning we have a fats going to 20 to 30, but in this case you see we will reduce carbohydrates, so we would want our fats to take up all this. And I'm not talking about the unga mafuta ya kupika thing. No, I'm talking about nuts, I'm talking about avocados, I'm talking about seeds, maybe like chia seeds, fenugreek, fish, all these things that have the good fat. Another way that you can increase your fat intake, you can do a cod liver oil supplement. You can do also milk, creamy milk. Milk has good amounts of fat. You can do yogurt, and then from now we've taken care of 40 carbohydrates, 40 fat, and then we are remaining with 20. Let's do our protein. Our normal protein intake will be between 10 to 15, but since we are pregnant and our cells are dividing, we are producing, we need to increase the volume, our blood volume, because of increased circulation, increased needs, and all this. Let's work with 20. Again, diversify, so that you can do some things like lentils, you can do something like beans, you can do meat, lean meats, you can do fish. Fish is great, but again, do not overdo it, because maybe of the mercury or the other metals and all that. So, and then omena, sardines, you can do all this. Just make sure you combine both animal and plant protein. Do your eggs. Make your diet as varied as it can be. You've taken care of the combination, how you want your meals combined. So you also remember that fruits are carbohydrates. So when you're working for the 40% or the 40 to 45%, the fruits come in there. We want to make sure that we are controlling these things that trigger insulin. Also protein, when taken in excess, protein triggers insulin. The only thing that will not trigger insulin as much is the fat. But again, you see the fat sources also have some carbs, so we are not going to overdo any of those foods. We are going to control the amounts that you are taking in. That is the dietary adjustment that you are going to take when tackling gestational diabetes. Also remember that apart from this, the frequency of feeds, what you eat and how you eat, and what time, the timings that you eat in matter a lot. So what you eat, we are eating the 100% combination that I have talked about. That is what you are eating. How frequent are we eating? Let's reduce the insulin spikes as much as you can. Let's do 3 main meals. You can do 3 main meals and a snack. Or if in the 3rd trimester maybe you're getting too hungry, you can do an extra snack. But make sure that the snack is healthy. Pregnancy and cravings, and sometimes it might be hard for us to keep in line with this, but try as much as you can to do that. I did a video on pregnancy and nutrition. I'll definitely link that down so that you can check it out, on how to plan your meals to make sure they're as healthy as you can when you're pregnant. But again, you see, we are trying to control diabetes, the gestational diabetes here. So we want to make sure that the planning also matters a lot. So carbs, we've talked about 40 to 45, fats we've talked about 30 to 40, protein we've talked about 20. That is the dietary aspect. So if you go to a clinic and your doctor tells you to adjust diets, you don't need insulin and all that, you need to make sure that you adhere to what you're being told, and to make sure that your diet is as healthy as it can be, so that you make sure that you don't advance to the next stage that will need medication. The other aspect that you're going to control diabetes with, or gestational diabetes with, in pregnancy, is exercise. Why do I tell you to exercise? Exercise is great. It improves fast, it improves mood, and then secondly, it improves weight gain, and it improves your weight gain chart in pregnancy. So it controls the amount of weight that you're going to gain when you're pregnant, and then apart from that, it improves your blood circulation, because there's increased, if you do aerobic and you do good timings, there's increased circulation, there's increased oxygen and all that, so the nutrients get to the baby fast. faster, then the excretion process it's out faster. So you see, we want to incorporate exercise in your daily routine. And then there's also this excuse that women have, that we have as women, that you're pregnant, you don't even want to move, you want to send everyone to even get you the smallest thing, you don't want to move. Please move. It is important. Please move. Moving is very beneficial to your brain cells. You see, your baby is also developing. They are depending on your metabolism. And then this is controlled in the brain. And then moving is beneficial to your brain. Jikaze. I know it can be hard, it can be tiresome, but please jikaze, move. Give yourself like a target per day. If you're not on bed rest during pregnancy, give yourself a target, a daily target, whereby you say, every single day I'm going to do a walk. I'm going to do like 10 to 15 minutes. This thing that goes around that says that we walk immediately after exercising, and to reduce postprandial glucose. You see, what my take on it, I will not recommend it so much, because you see, you're already pregnant, there's a lot of, let's say, stretching inside there. There's a lot of, already your digestion is compromised. Most women who are pregnant experience maybe constipation, small to complications of digestive tract, you see. And then now you see, you want to come in and confuse your system again by working out immediately after eating. Take your time, take like maybe 1 hour, then you can walk, or walk and then take like 1 hour, then exercise. Then there are things that you need to consider when you're going for exercise. If you have gestational diabetes, before you even go for a walk, be having your glucose checked every now and then. So you see, if your blood glucose is high, just let it cool first before you can go for exercise. We don't want to trigger ketoacidosis with a high blood glucose, so make sure that it doesn't get to there. And then if it is low again, you can do a banana or an apple, so that it's for energy and to avoid you going hypo when you're walking. And also make sure that you're properly hydrated. Take fluids before, during, and after exercise. Not go and buy those store juices. So if you're walking, you need something a bit. You need to replenish your potassium. You need to replenish your other ions. So clean your vegetables or your fruits that you're going to blend well or to juice well. When you're doing your fruit juices after exercise, they are very, very important, because they will help you replenish the ions and nutrients. So I'm not expecting you to go to the gym for 1 hour when you're pregnant, but I'm expecting you to go work out. You can do the work with someone. Make sure that you have someone who is helping you, who is watching you, who is, just in case of anything, maybe if you faint or something like that. I don't know, I'm not expecting you to faint, but just in case something like that happens, make sure that you have someone with you who is going to help you just in case that happens. So I think that's it about gestational diabetes. Take home note: this condition is rising high because the metabolic conditions that are increasing, that were not in our norms previously, is because of the dietary habits. Our dietary habits are really, really I don't want to use the word pathetic, but they are bad. They are bad, and they are getting worse, because you see now there's a lot of exposure, there's a lot of availability of this processed, refined, the sugars and all that. You see, we want to avoid to be as healthy as possible. I've not said about not taking carbohydrate. I've just said take the healthy ones. And also, when you're going to the store, just read your food labels, understand what you're going to take, especially if you're pregnant, because the outcome of this pregnancy depends on you as the mom. Yeah, so you need to take care of yourself as best as you can, so that you make sure that you promote a healthy outcome, a healthy baby, a healthy mama, and a healthy society. Thank you for listening, and I hope you learn a thing or two. And let's keep it here. We'll learn more. Bye.